Hi, everyone. Thank you so much for joining us for today's CareConnect Convo. We're super excited to have Dr. Chandra Chaudhuri with us. Dr. Chaudhuri is a family medicine physician at our West Grand Parkway Clinic. So welcome, Dr. Chaudhuri. Do you want to tell us a little bit about your practice and your background as a physician with Kelsey?
Sure, absolutely. Well, we're so lucky to have opened up our new clinic here in West Grand Parkway. We have a lot of specialists within our building, which is excellent because myself and the six other doctors here. We just hired 3 new doctors. We were also busy with our practice, and that means that our patients want to see and need to see specialists. We have a lot of specialists within our building now: pulmonary, cardiology, OBGYN, orthopedics.
Mhm.
So a lot of services that can be offered to our patients that we didn't have at our previous location. But I have a full practice. I've been with Kelsey-Seybold for 14 years, and just very proud to be here. We offer excellent health care, and as I was saying, multi-specialty practice. So a lot of help from other specialists, and it's good to be here. Thank you for having me.
Awesome. So I see we still have a few people joining us. We'll do some housekeeping quickly before we dive into our conversation with Dr. Chaudhuri. For those of you who are joining us for your first CareConnect Convo, thank you and welcome. We're super excited you are logging on with us today. We want you to ask questions and encourage you to ask any questions that you may have during our time with Dr. Chaudhuri today. But just to let you guys know, we do have a hard stop at 12. We want to make sure Dr. Chaudhuri has time to get back to her patients and we don't interrupt, her schedule with that. So if we do stop fairly quickly as we get close to noon, we'll do our best to get the questions that we didn't answered via email for you. If you do have questions, there's a little sort of row that pops up at the bottom of your Zoom screen. There's a Q&A box and a chat feature. You can submit any questions you have during our time today via that, and we'll go ahead and try to field those as they come in and get those questions answered. So I guess we're going to jump right in. We're in fall, trending into winter. That is cold, flu, allergy, sinus, and every other crud season here in Texas, it seems like. What are you seeing with your patients right now with trends with, colds and allergies and flu?
So you're absolutely right. In this fall season, it's pretty typical to see more patients coming in with allergies, especially in our community here in Houston. So typical symptoms of allergies would be sneezing, itchy eyes, runny nose, that sort of thing. And then in terms of flu, I'm lucky, but I don't think any of us here in our building has seen too many cases of flu yet. I've heard flu B is definitely being seen in the community in urgent care ERs, but we haven't seen a high level of flu cases yet. Go ahead. Yes.
Oh, I was going to ask you, is there a difference between flu A and flu B? I know that's a common question that we see submitted about during flu season.
They're both cases that lead to the flu disease influenza. Sometimes one seems more virulent than the other, meaning like you seem or get more sick. And right now we're seeing cases of flu B. And from what I've seen and heard, it's the common symptoms and disease process that you see, which is headache, body ache, fever, and general not feeling well.
So when we talk about allergies and colds and flu and even COVID thrown into the mix now this year, how do you differentiate the symptoms or the signs that you're seeing in your patients between all of those?
Yeah, that's an excellent question, especially when we have some fears of COVID-19 and flu. So typically with the common cold, COVID-19, flu, and allergies, all four we're going to see some form of upper respiratory symptoms. Now, allergies, the easiest, as I was discussing before, we typically see sneezing, itchy eyes, runny nose. The symptoms also kind of come and go. It's not that you feel ill And you shouldn't see any infectious symptoms with allergies, such as fever and feeling very sick. So that's allergies. Then with the common cold, which is usually caused by viruses, typically we also don't see so much of the fever and chills. It's more of the sore throat, runny nose, nasal congestion. And then that leaves us with flu and COVID-19. And those two, we do see more similar symptoms. And so in those, we will see typically, but not always, with the flu, we'll see fever, body aches, chills, and usually headache. In COVID-19, you may see similar symptoms. So there's definitely some overlap in the symptoms of flu and COVID-19.
So let's say, you have a patient who's presenting with fever, body aches, headaches. What would be the testing protocol you would follow for your patients? Would you test for flu then COVID, or COVID, then flu, or both at the same time?
Yeah, so at Kelsey-Seybold and many other facilities, we do have the ability to test for different diseases with one test. And in that situation that you just presented, somebody with fever, body ache, flu-like symptoms, we would test them for sure, both for flu and COVID-19.
How is Kelsey testing for COVID-19?
So we have a swab and go policy. So if you have symptoms of COVID-19, then you would call in and do a telemedicine visit with us. And you'll discuss your symptoms with the physician, and we can then get you into one of our testing sites, which is a drive and go type testing site.
Awesome. How long is it generally taking to get results back for COVID tests?
Typically, it's about 2 to 3 days.
And are we seeing any patterns in, trending more COVID or trending more flu with positive tests now that we're moving into the fall and winter?
Yeah, as I was telling you before, in my clinic here, we haven't seen too many flu cases, but I do know that flu is out in the community. I will tell you what we have seen with COVID-19. Previously in June and July, we were seeing a lot of cases. I am not seeing that many cases of COVID-19 right now. It's still, of course, in the community, but a lot less than we did back in June, July, August.
So the big question here, can you test positive for COVID and flu at the same time?
Yes, it's definitely possible to test for both at the same time.
What would would that be something that would be normal or probably pretty abnormal? Is there, a higher chance that can happen to someone?
Well, the theory is that usually somebody's probably getting exposed to one before the other. And with both influenza and COVID-19, you're going to have somewhat of a suppressed immune system once you have that disease. And that makes you more prone to catching something else, not just COVID-19, but other illnesses, viral or bacterial. So common cold or bacterial strep throat. So essentially, it's more of the immune system that's suppressed, and then now you're prone to catching something else.
So let's talk a little bit about the flu shot. I know here at Kelsey, our physicians have been encouraging all of our patients to get their flu shot this year. Can the flu shot prevent you from getting COVID?
So the flu shot can't necessarily prevent you from getting COVID. The flu shot is given to lessen our chances of getting flu. And usually it's about 40 to 60% lessens your chance. Mm-hmm. Now, as I was saying before, if we do lessen your chance of getting the flu and you have a stronger immune system because now you don't have the flu, then yes, that can lessen your chance of getting COVID-19 indirectly.
Okay. Yeah, no, that definitely makes sense. So let's talk a little bit more about allergies. As we trend towards the winter, do we expect allergy symptoms to decline while we would see other, possibly colds, like an increase in colds or flu? Or with allergies, is it pretty much, stays the same throughout the fall and winter in Houston?
Of course, it sort of depends on the patient and what they're allergic to. But yes, it's more of a what's out in the community that causes this kind of seasonal allergies. And typically it's the fall and the spring when we see our allergy patients having more allergies. So usually it's October, November when I see more of my patients having allergies. And then, yes, it does sort of lessen through December, January, February, and comes back again in March.
I know mine do, but I know everyone's different. So,
yeah, mine do as well. So that's usually what we see with allergies. And then, as you were saying earlier, yes, then that leads into the more of the flu season and the cold season as well.
So if patients are having symptoms we've talked about, runny nose, congestion, fever, sneezing, what should they do? Should they immediately try to get a COVID test somewhere, or should they call and book a video visit with their primary care physician at Kelsey?
Every patient is different, and it's really important to get their history. So if they have a history of allergies and they know that this is their seasonal allergies, it just feels the same, and they have no infectious symptoms. So that was what we were talking about before. That's no infectious symptoms. So no fever, no body ache, just in general, some sneezing, itchy eyes, runny nose that kind of comes and goes. That's maybe alleviated and better after taking out anti-allergy medicines, then they could probably wait for a day or two and see how they feel. Again, history is important. Were they recently exposed to somebody potentially with COVID-19? I wouldn't wait for them to develop those other symptoms. If they know they had exposure to somebody with COVID-19 and then start having a runny nose, I would be a little more worried and consider doing the test. So very important to really discuss it. If you're concerned and you have some thought that maybe you have exposure and this doesn't feel right, it's best just to go ahead and schedule a telemedicine visit with your primary care physician.
Awesome. And can you talk a little bit about the telemedicine and video visits at Kelsey, and maybe sort of some of the other options that are available if you aren't comfortable coming into the clinic?
Absolutely. So, we're very lucky at Kelsey-Seybold. We already had our telemedicine system incorporated even before COVID-19 started, and we were using that option for our patients. Of course, now it's more patients are using it. So pretty much most all insurances, I believe, have the option of using the telemedicine system to schedule an office visit. And anyone who is sick, we encourage them to do the telemedicine visit because we certainly don't want them coming into the facility, exposing other patients, staff. So that is an option. Our Kelsey Care Medical Advantage Plan patients, our elderly patients, they actually also have an option of phone visits. So that's an excellent tool if we're having problems juggling and figuring out how to use the phone and the telemedicine app. And then you asked about in-office visits. We've been open and seeing patients and encouraging them to come in for all the other healthcare needs that they need, their complete physicals and women's and their continuing care for other disease processes like diabetes, high blood pressure. So I really, really encourage patients to come in. Don't be worried with the fear of COVID-19. We really have things under control. Kelsey's done an excellent job of screening staff as well as patients coming through the building. So as I said before, we're really not seeing sick patients here. So it's a very safe environment, and I really encourage patients to continue their medical care as they have in the past.
So you mentioned sort of routine medical care. What, if someone wanted to see you as a patient and they were a new patient, how would they go about booking their annual physical or a checkup with you if they wanted to do that?
So they can call our main number, the 713-442-0000. And then I believe they will initially do some insurance information and they can get established that way. And if they can join the My Kelsey online. And then now you have an application you can also use. So you can either call the main number and schedule an appointment with the help of our call center, or they can assist you in downloading the My Kelsey online app, and you can schedule yourself for whichever visit type you'd like, which would be a physical or a first time established care visit, which I encourage that oftentimes if, a patient is coming from a different facility and you want to get to know each other and get to know their medical history, schedule a first time office visit to establish care with your primary care doctor.
Awesome. Well, we are going to go ahead and start wrapping up our conversation today. Does anyone have any other questions for Dr. Chaudhuri before we go ahead and leave our Zoom? Oh, here we go. We have some more questions coming in. Another question came in about the flu shot and COVID. Do you want to just touch on that a little bit more? They asked if the flu shot can help against COVID. You may have missed the first part of our talk.
Yeah, so we were talking about the flu shot can decrease your chances of getting influenza. Hopefully, usually we shoot for about 40 to 60%, usually about 50%. So if we're decreasing your risk of getting influenza, flu, then your immune system is stronger. And then if your immune system is stronger, your chances of catching COVID-19 is lower. I will say, Lane, that there has been some reports that have come out, and understand coronavirus is new to us. So a lot of literature that comes out may not be statistically significant. But in recent readings, I've seen some thought that if you get the flu shot, then your body may actually create, as they put it, molecules, not antibodies, to decrease your risk of getting COVID-19. Yeah. So there is something out there about that. We let's assume that maybe it's true, and let's use that as a good reason to go ahead and get the flu vaccine.
Yes, our whole family got it. All 6 of us. Every year we make a little yearly trip to one of our clinics. We went to our Clear Lake clinic this year, and we all get our flu shot, and it's so easy, guys. So if you haven't done it, you can make an appointment with the nurse at any location to get your flu shot. You're in and out really quick. It's really not a big deal at all. We have another question that came in about COVID in children. Do children, in fact, carry COVID-19?
Again, that is, as I was saying before, there's a lot of things that we don't know about coronavirus. So I can just only report what we've seen. And so there is some theory that it's possible that because children don't have as much of an active illness when they get COVID-19 or coronavirus, that they don't seem ill. Okay, so they may carry it and we may not know that they actually have the disease process. But our kids have been going to school since August now, and in terms of if that was true, we would probably be seeing a lot of cases of exposure where the kids are going to school and then get exposing others. And we really haven't seen a high rate of increase after school has started. So I think that the idea of them being carriers and really carrying it in a large percentage is probably not correct.
So we have another question that came in about COVID. How can citizens be confident that the COVID vaccines that are being developed are going to be safe and effective?
Well, I would say that with all other vaccines that have been created in the past, our researchers do their best. Drug companies do their best in creating the best vaccine. So just as we have the flu vaccine and we've gotten these vaccines as well as other vaccines such as shingles, pneumonia vaccine, typically patients do fine, and studies are done and tested prior to the general population getting these vaccines, and they do fine with it. So I'm pretty confident that we should be fine with this vaccine.
Do you have any recommendations for legitimate sources where patients can read about vaccine information? We know there's a lot of misinformation out there. So where should they go to look for information about vaccines?
I think the CDC would be a good place to research and look into it. And I'll always encourage our Kelsey patients to look at their emails and information that comes from our organization. I'm confident in our organization. We usually will give you information based on the CDC guidelines, as well as a lot of other organizations compiled information and come up with a plan. So those two would be probably my top two.
Awesome. Okay, well, we're going to go ahead and wrap up our call to give Dr. Chaudhuri some time to get settled before she sees her next patient. So thank you again to everyone who joined us for today's CareConnect Convos. We will have some more online events coming up. So definitely go to our website, Kelsey-Seybold.com. And on the top right, there's a little drop-down menu that says About and Events. You can go there and see what we have coming up next and RSVP for those as well. Thank you again, Dr. Chaudhuri. And we hope that everyone has a great afternoon.
Thank you so much.
Bye.